Iowa is reporting its first case of measles since 2019, the latest in a list of 31 other U.S. states and jurisdictions in an evolving outbreak. A little information now about measles. It is a highly contagious virus. It spreads through the air when an infected person coughs or sneezes. It can cause a fever, cough, runny nose, and a rash, and it can cause severe complications. So far this year in the U.S., there have been 3 confirmed deaths from measles. A Local 5's Larissa Leone joins us with more from the Iowa Department of Health and Human Services. Well, Larissa, what are we learning about this case?
Stephanie, according to HHS, the confirmed case in Iowa is an unvaccinated adult in the central part of the state. The patient tested positive for measles through the state hygienic laboratory. Tonight, I spoke with an infectious disease specialist on what you need to know to help prevent the spread of measles.
There are reportedly 1,046 cases of measles across the United States. That's according to the Centers for Disease Control and Prevention's most recent data, a number that is startling to doctors nationwide.
In the healthcare community, we are extremely concerned about measles because we are seeing more cases than we have in decades.
Iowa Health and Human Services has confirmed one of those cases has popped up right here in Iowa, with an adult being infected. Though it's only one case in the state so far, Dr. Joe Waddell says there is a potential for more.
I think there's a very good chance that measles will unfortunately infect and affect our communities in the United States and in Iowa for some years to come.
Public health officials have investigated this case and will be reaching out to anyone who may have had contact with this person. HHS emphasized at this point no widespread public exposure is anticipated, but they do encourage all Iowans to check their medical records and get up to date on the MMR vaccine, a recommendation echoed by Dr. Waddell.
It's a very safe vaccine, tons and tons of experience with it, and it has a very, very good protection rate. So with one dose alone, at least 94% of people would be protected from measles.
If you haven't received the MMR vaccine and are exposed to an infected person, there are options for you to receive help.
You might qualify for post-exposure prophylaxis, and so that usually would be getting an MMR vaccine within the first 72 hours.
If you think you have been exposed, HHS says contact your medical provider or local emergency room. Let them know you have been exposed and describe any symptoms before you show up in person. They will give you advice on what to do next. More information can be found on our website at weareiowa.com.